Afternoon, everybody. Welcome back. This is Friday Drinks and Saura Marketplace, and we continue talking to the different SBUs and people actually on the marketplace. And of interest is Dr. Charles, and he heads Zambezi Medical. So maybe to just start off with, tell us exactly what you guys actually do.
Okay, well, thank you for inviting me to Friday Drinks, and happy to be on this, join this marketplace event. Zambezi Medical is a platform that allows people who are living outside the country to send healthcare to their families back in Zimbabwe. So what do we mean by that? What I mean is that where you would be sending money, which is a significant part of what happens to Zimbabwe, you send a healthcare package instead. So that means through Zambezi Medical, you can pay for medical aid packages, you can pay for doctor's visits, you can pay for prescriptions, you can hire nurse aides. So a variety of medical services, and Zambezi Medical is the platform through which one can do that. And that's got its particular place. We know that remittances into the country a significant way that the diaspora contributes back home, but a lot of that is actually geared towards healthcare. And Zambezi Medical provides a way of making sure that where you want them to get healthcare, that's what they get. You can still remit for other reasons, but this is specifically going towards healthcare. And where we are looking to go in future is having Zambezi Medical as the medical marketplace for where people who are outside the country will be able to come to Zambezi Medical and look for all health-related products that they need for their families back in Zimbabwe.
Okay, fantastic. We do have a doctor on the show, so he has actually allowed Rufaro to actually have a drink. So maybe, Rufaro, you can tell us exactly what you're having.
Really? Oh, my gosh.
He gave you the pass.
Yes. Well, apparently, it's good for the heart. So
is that true, doctor?
To some extent, everything in moderation is not bad for you.
Okay.
So this is a Cape blend. It's a Bordeaux blend. It's called Cadet. And, I credit my partner in crime here, TG, with the selection. It is quite delightful. So cheers, Doc.
Cheers.
Well, I must say I do envy the drinkers on the show. They have someone who is actually dedicated to ensuring that they're okay. Us as teetotalers, unfortunately, we don't band together. So I have to take care of myself. And
you're drinking
white premium lemonade. This is the best we could do.
Is that your drink of choice?
No, it's not.
Wow.
But like I said,
anyway,
it is what it is.
So the doctor was generous enough to share with us some stress balls. So I think you can start using yours.
Yeah, I need it.
Yeah,
Doc.
In fact,
please explain more.
Just a point of explanation. These are Zambezi Medical stress relieving balls.
Okay.
Not stress balls. Sorry. It's just good for you.
Stress relief.
Okay.
And how does it actually work?
Well, I mean, you would. It's just a way of just getting your concentration, getting your mind distracted in a certain way. It's just for some people it works that way. So for those, I've got a couple in my office that I use when I sometimes when I'm in deep thinking. I've got some of these that I just use for that. But it's a question of personal preference and whether that works for you.
Okay. Yeah. Maybe because it's a ball, it might actually work. Okay, so let's expand more. So we've got, when did you actually start Zambezi Medical, and how's been that journey, especially from the UK and interacting with Zimbabweans?
All right, okay, yeah, sure. So as mentioned earlier, I'm a consultant physician here in the UK, and I've been here for quite a few years. Through that process, I've always and used to come across people asking for assistance with one thing or the other, medical, home. This is the problem with data. This is the problem with medication. I found myself in a position where I was giving this advice, and that's where the idea came to me to say, well, why do we not structure this in a way? There's clearly a need. There was need to create a structure that allowed people who are living away from home to have a way that they can support their families home. So the next phase of that was to identify that, okay, what sort of services might people need, doctor services and so on. And so went around looking for reliable partners in Zimbabwe who would be providing the healthcare. So that's how the Zambezi Medical platform was. I created that and founded that about 11 years ago now. And over the years, we have served hundreds of Zimbabweans who have been able to remit healthcare back to their families in Zimbabwe. As I said, what we provide is an easy way of sending health to your family rather than actual sending money, because money can do all sorts of things, but
Or it can disappear.
or yeah, and things can change, and that is something that people find convenient. Through Zambezi Medical, people are able to pay directly into a UK bank account, and we make sure that their premiums and payments get to Zimbabwe through our various other channels. Now, over the years, we've had our ups and downs, and the uptake has been high. However, there have been problems where service provision sometimes hasn't matched expectations of people over here. And some companies we started with, we're no longer working with, but we try very much to try and have a selective approach to who we partner with in terms of provision on the ground, because it's important. Ultimately, what we want is for people to get, care back home in a way that the sponsors expect. So it's been ups and downs. I know that medical aid penetration, for example, medical aid is our main product that we do with several companies at the moment. Medical aid or insurance penetration in Zimbabwe has actually been shrinking over time. It's been getting very, very expensive. And of the medical aid companies that are providing services, few have been provided care for seniors, i.e. people over 60, 65. That's a particular area of interest for us at Zambezi Medical, because the demographic that we deal with in the diaspora is people who are generally taking care of older parents back home. So there is a need there for products that are able to support, the pensioners and the people that are there.
What do you think that's the problem? Because I think that's a very uniquely Zimbabwean problem, right? Because everywhere else, our pensioners are well taken care of. Whereas in Zim, is it because of the chronic illnesses that are, particular or unique to Zimbabwe?
I do not think that we've got any particular difference in terms of the prevalence of chronic conditions. I think we have got our fair spread of that, but I think the environment has changed in the sense that a lot of these pensioners perhaps were in a situation where they were working for companies that were able to support them in terms of medical aid, medical cover, and so on. And then when they leave work, they find that support is no longer there. The costs, there's an assumption that the older people are, the more expensive they are to for healthcare for them, to support. It's not. It is true because they have more what we call illnesses or comorbidities, but it should be possible to create products that help to prevent people, take care of the preventive side of healthcare, as well as give them treatment when they need to. And I'm excited that, in the Saura Marketplace, and over the last couple of years, I've had discussions with companies in Zimbabwe where perhaps we're going to start seeing more innovative products coming onto the market. And Zambezi Medical is there to partner with the various providers that come up with suitable products.
Certainly, you would hope so, because we are living longer.
Yes.
Even in Zimbabwe, I mean, for the last decade or so, I think the average, what's it called? Lifespan, life expectancy.
Life expectancy, yeah.
Was somewhere around 37, 38. It's moved to 62, 63. And around the world, it's now in the 80s.
Correct.
And I just saw something that was very interesting, and I want to hear your thoughts on this. Obesity levels in America has actually been on a decline, primarily because of the medicines that are there, and that was, the primary cause of death and lower life expectancy. So we're more likely to live longer. So how come the industry hasn't reacted as quickly, especially from a Zimbabwean perspective?
Yes, I mean, I presume you're talking about it in terms of the
Provisions.
Insurance or the
the insurance for the elderly.
Yeah, there has been, I think, to my view, a difficult balance has been. There's been no balance that's been struck about when you look at what are the costs of providing healthcare within our economic environment. And it's a distorted market.
Okay.
I think it's a distorted market, and I think individual players find that they're having to do things that help them to survive. So you might have companies that will give lots of shortfalls, or care is not provided at the point that people really need it, and in a way of trying to balance the books. You've got an increasing number of medical aid companies now creating their own hospitals, pharmacies, laboratories, and so on, in a way of being able to contain their costs, because the general environment there is not allowing them to do that. But it's not for me to say how this thing works, but patient choice has got to remain important in terms of the healthcare that people get. It's something that I, as a doctor, think is important, but business models have to work. So the whole kind of environment just needs a relook into it, in terms of how healthcare services are provided, and
Certainly.
newer ideas are required.
So from my observation, over the last 10, 15 years, there's been something of a transformation in the health industry in Zimbabwe, where 10, 15 years ago, the attitude of the biggest insurers was that their core competence was actually the admin, where they collect the premiums and then they administer claims, and they figure out what they'll pay the service provider for the different services. And they stopped there. They didn't actually vertically integrate nor invest in any of the service provision, be it the consultancy with GPs or pharmacies, clinics, hospitals, at all. And then there was a shift because of what you guys have spoken to around the costs and the quality of service, that, the claims ratios in Zimbabwe were extremely high, and they correctly identified the problem as the costs. And one of the ways to manage the costs is if you vertically integrate and you own a bunch of your own clinics and hospitals and other service providers. And I think all the big medical insurers have jumped onto that bandwagon. I think famously it was the government-owned or the government-run medical service that pioneered this. but there were various scandals there. But all the big medical insurance businesses today in Zim are vertically integrated. They also have a stake in service provision. And they seem to be on an ongoing basis committing meaningful amounts of capital to that side. So is it correct to assume that if this trend continues and more capital is allocated to building out health infrastructure, that the economies of scale will start to kick in, and we will see the cost curve bend significantly lower?
One would hope that would be the end result. Vertical integration obviously allows organizations to be able to control their costs in a way that makes it possible to run the enterprises successfully. There's a flip side to it, which is that patient choice becomes restricted. But there's no, one cannot take a naive approach and say, well, it's got to be one or the other. It's got to be what works within our environment. In that journey, I think we just have to be sure that there is checks and balances that allow. You do not want companies that come and raise capital on the market and then not provide services. I think there must be ways in which that can be monitored and assure patients that they are, that they get the services for which they have paid. So there are the models which, if taken on a larger scale, if it was a national health insurance scheme, for example, that would be a perfect example of integration. In terms of,
would it?
Well, yeah, yes. I mean, because in the sense that there's a contract there for you're paying to your insurance, and that gets invested into your service provision, and in a much bigger sense like that, you don't have the skewed monopolies or one player playing.
Because Tinashe and I would push back and we would say governments across the world are awful at running anything, right? That the private sector is good at doing.
Yes.
So if it's provision of health care, right, and right here in the UK, there are waiting lists, and the NHS has all sorts of issues. And I would make the case that these huge bureaucracies of national healthcare operations have failed. They are wasteful and they have awful outcomes.
Yeah, I could say I work in the NHS. I'm a consultant there, so I know some of the issues that you're talking about. But
you don't have to. If you work for the NHS, you don't have to.
We excuse you.
Yeah, you can be excused.
No. I think I can definitely say that there's certain great things about the NHS. The being free at the point of need, even if you've waited 3 years to get your knee operated. But it's free at that point. So
what are you doing in the meantime?
But what I can assure you is that within the NHS, it's probably the best place for you to have a heart attack, for example, because you will get all the care that you need. In an emergency, the NHS will respond in a very meaningful way. So, there's checks and balances, and people pay for that. So, it's neither. It doesn't have to be either or. But I think what you want is a good measure of public-private partnerships and regulation that has got the patient at the center of what is going on.
Okay. And because you actually work for the NHS and you have some sort of understanding of what actually happens in Zim, let's get into the weeds and the details of, let's say somebody has been on the NHS and has been in the UK for the longest, and now they've retired and they're going to Zimbabwe. What are the costs differentials between healthcare in the UK and healthcare in Zimbabwe?
I must say that's possibly one of the key considerations for people who've stayed in the UK or anywhere else. It's certainly in the UK. I can talk about the UK. Concerns about access to healthcare are a big part of the concerns that people have when they move back there, because here healthcare is essentially free at the time, at the point of need. And that goes whether you're in employment, whether you're not in employment, you're always covered. Whereas if you go back home, that provision is not guaranteed. You need to have the resources to be able to pay for your healthcare. And so for the older part of Zimbabweans who have lived outside the country, it becomes an increasingly difficult choice to make a move where your health needs probably are mounting, and maybe your income is no longer, and you're no longer as flexible in your income. That is a conundrum that faces people when they move. Yeah.
And when you look at the costs, so sorry, I'm just stretching the model because I just want to, I've got many thoughts that are running. Let's say you've got a pension that's running from the UK, but you now live in Zim. Would that make it affordable? Because you've got a pension in pounds, and then you've got a cost that's in Zimbabwe. Would that make it more feasible, or that's still stretching it?
Certainly, it makes it more feasible. I mean, only in the last week, we've had a couple of people who have come to Zambezi Medical with, they're moving back to Zimbabwe, they're moving back home, and they would like to continue paying for their premiums from here through Zambezi Medical, or, they were actually new clients coming on because they want to set themselves up for care when they get to Zimbabwe. So yeah, it is. If one has got income here and you've got a way of getting your medical aid payable there, then it's certainly you're in a better position than others.
Okay, fantastic. I think we've got a very good grasp of the Zambezi Medical and what you guys are actually doing, which is fantastic. Now let's just get into the personal. You're a medical doctor. You're not well known. Doctors are not well known to be entrepreneurial. And then there you are, entrepreneur. Would you like to just maybe expand on the story and how that came about?
Yes. I really enjoy and I love medicine in terms of the craft. However, I've always thought that it is there's other aspects to life where you need to be able to sustain yourself. If you, medicine is a trade that requires me to be capable of doing it myself. The moment I stop doing it, I don't earn. So I think that is one of the things that I was thinking about. And we went to medical school. I were told nothing about money. I mean, no idea how to run a business or anything. And, so I always thought that was a shortcoming within our space. So when the concept of creating Zambezi Medical came up, I thought that was a good way of mixing in my professional experience and capacity and looking in a sustainable way of creating something that gives value to our customers here in the UK for the people that are getting the benefits in Zimbabwe. So yes, I earned my title of Dopreneur in that sense, I found it increasingly interesting to do a few other things with the Saura Marketplace. We've various other things that we're looking at, but that has been an interesting journey. I've been learning because I'm essentially a doctor at heart, and I'd always like to continue practicing medicine, probably scaling down a bit in the very near future in terms of that, and maybe looking at these other aspects which might hopefully we get into the wider healthcare provision sphere and
where is the entrepreneurial bug coming from? Were your parents entrepreneurial? Or?
No, my parents were pretty standard headmaster and nurse.
Okay.
You know, it's just always been there. I don't know, what would have. The inspiration was, I think, just being when I finished my specialist physician training, one of my consultant colleagues came to me and said, Charles, now that you're becoming a consultant, you can be, you can just stay there. You can be ordinary, or you can try and do, other interesting things. And I think I've always wanted to do that. I trained my medicine in Zimbabwe. Coming to the UK to specialize here was not because I wasn't moving over economically. I just thought when I was a trainee doctor that one needs to just go outside, experience different things, and it's just the way that you've got to look at different things. So I was just curious in that sense, and I don't know.
Are your kids entrepreneurial, or they're more medicine, science?
Oh, yes. Well, my daughter is a doctor in New York now, but that had nothing to do with me. I didn't really, but she insisted that that's what she wanted to do. My son is more on the entrepreneurial side. He studied law, working in the financial sector, and my last girl is doing some solutions engineering stuff with a big tech firm in London as an apprentice. So, yeah, we're a whole spread of different things. But I find it interesting. I'm learning a lot from business discussions here and so on. And I always have my medicine to fall back on.
Yeah. Fantastic. One of the things I've always been curious about when I think about your sector is, globally there's this phenomenon of medical tourism, and Cape Town has done really well in this space. India also seems to have done quite well. One of the reasons why Cecil John Rhodes spent a lot of time in sub-Saharan Africa was because he was sickly, and the wonderful weather we have in that part of the world agreed with him better than, the weather up here. And I've always been curious about our potential as a medical tourism destination, because we've got fantastic weather all year round. We do have a cohort of the medical expertise. A lot of extremely successful medical practitioners all over the world were actually trained in Zimbabwe. But it's just one of those things that we talk about the potential and we never see anything interesting happening on the ground. So is it just a fantasy, or is there something that could happen where we build an industry in Zimbabwe that is focused on medical tourism, and people come through and they have this experience where they're somewhere beautiful with great weather and you have top-notch medical care?
Yeah, that's a very interesting point you raise, and I totally agree with you. We've got a lot of resource in terms of Zimbabwean specialists all over the world, and we've got an increasing number of locally trained specialists in a whole lot of fields. So we've got specialists in Zimbabwe. And one of the things that I have learned as a consultant in the UK, and seeing doctors come from Zimbabwe to work in this country, I've never been disappointed by the quality of doctors that we produce in Zimbabwe, even to this day. So we've got the manpower to do that. Now, in terms of setting up centers of excellence and setting up health tourism, this is an area that I actually got involved very actively with a few years ago, and made a trip to India to see their health expo that they had there. What struck me is that when there was a deputy minister from Zambia, there was a minister from Tanzania, There was someone from Kenya, some really high-level people who were coming to this conference. And I was left thinking that we're all these African countries coming to see how we can send our patients to India for treatment. Why can we not at least create a regional place where people can come? So we came out of that with an idea, spoke to some specialist cardiology hospital there, and agreed a situation where we were going to get specialists from India coming in to do their heart surgery, their kidney transplants, and whatever specialisms that people traveled for
to India.
But come and do them in Zimbabwe whilst training our own, so that we developed that. And we actually moved on a bit. We'd identified sites for doing it and so on. But for reasons that I don't clearly understand, that didn't take up. So, but it's an idea that I totally think would be possible to do that.
Maybe they need more of these balls.
Yeah, and we've got Vic Falls for creating for example, if one was able to do that. And I've seen ideas like that being floated about. But we definitely have the manpower and we've got the weather.
Absolutely.
Yeah,
Yeah.
beautiful country.
I think it just needs, people pushing as hard as possible. It's never easy, but I think it's a great idea and a great initiative. And I suppose it should come from the doctors themselves. But
What can come from bankers? How much money do you think it would take to set up a world-class facility?
I could tell you exact numbers, but what I can tell you from my experience of that, following the Indian part of the trip, the finance was the easiest thing that, there were financiers ready to go with this if we could put it together. Okay. I think it's going to be financially possible to do it. It's got to make sense, financially and so on. But I think it's a model that can work. People would like to come from America and get their things done, and then go to Vic Falls and go on a safari and do all sorts of things. There's innovation that we could look at.
Absolutely.
Yeah.
Well, you heard it first, yeah, and that's why it's necessary to be at the marketplace. Ideas are flying around, but hopefully when we come in a decade, these are the sort of ideas that would have come to fruition, and we'll be going to Victoria Falls for treatment and all sorts, especially become a center of excellence across Africa. So Doc, thank you very much. Enjoyed this, and all the best.
Yeah, cheers.
To everybody, we're still here. It's Friday Drinks and Saura Marketplace. Cheers.
Cheers.
Sending money from the UK to Zimbabwe? Look no further. Introducing Saura Money, your gateway to seamless money transfers. You can collect at Saura Money Transfer Agency offices at selected Nyaradzo branches. With Saura, it's quick, easy, done.